How does PAE shrink prostate without surgery? Imagine a way to reduce an enlarged prostate without cutting or removing tissue. That's what prostatic artery embolization does. It works by carefully blocking the blood flow to the prostate gland. When the blood supply is cut off, the prostate tissue begins to suffer from a lack of oxygen and nutrients. This process causes targeted cell death, known as necrosis, and also triggers a natural process called apoptosis, or programmed cell death. Over time, the body reabsorbs the dead tissue and replaces it with scar tissue, which contracts and leads to a smaller prostate. This procedure is minimally invasive. An interventional radiologist inserts a tiny catheter through a small incision, usually in the wrist or groin. Using imaging guidance, they navigate the catheter to the arteries supplying the prostate. Tiny particles called embolic agents are then injected to selectively block these arteries. Because the blood flow is reduced, the prostate tissue softens and shrinks gradually. This process typically takes several weeks to months, with most patients seeing a prostate size reduction of about 20 to 40%. The shrinking of the prostate helps relieving pressure on the urethra, improving urinary symptoms like frequent urination, weak urine flow, and urgency. The reduction is gradual, giving the body time to adapt. Besides shrinking the prostate, PAE may also help relax the prostate tissue by reducing smooth muscle tone, which is partly responsible for urinary symptoms. Some secondary effects include nerve disruption and changes in local biochemical pathways, such as nitric oxide signaling, which can further improve symptoms. Because PAE does not involve cutting or removing tissue, it generally carries fewer risks than traditional surgery. It avoids complications like sexual dysfunction or urinary incontinence that can sometimes happen with surgical procedures. It is considered a safe and effective option for men with benign prostatic hyperplasia who want relief from symptoms without undergoing invasive surgery. It's important to note that PAE targets benign prostate enlargement and does not treat prostate cancer. A proper diagnosis is essential before considering this procedure. PAE does not interfere with prostate cancer treatments and should always be performed under medical guidance to ensure the right patient selection and monitoring. In summary, PAE shrinks the prostate by blocking its blood supply, causing controlled tissue death and gradual reduction in size. This process relieves urinary symptoms caused by prostate enlargement and offers a less invasive alternative to traditional surgery. Always consult a healthcare professional to determine if PAE is suitable for your specific condition.